Hello, my name is Martha Stancil. I am the Chief Nurse COVID Consultant for the Houston Health Department. In this video, I am going to discuss how we use wastewater monitoring data to help guide pathogen response to a school. Although set up for COVID-19 initially, the school wastewater surveillance program also tracks influenza and RSV. As a quick overview of what happens before I see the results of the analysis, the three pictures here show the process of sample collection of report generation. The samples are collected at the manholes at the schools and then sent to the lab for analysis. The data from the lab is then sent to the data team for analysis, and those results are then shared with me as part of a public health action. Some of my responsibilities include reporting these results to the schools, keeping a communication channel open with the school nurses, and engaging with the school community to make sure the school community is aware of what wastewater is finding. Currently, there are more than 130 sampling locations spread across 39 wastewater treatment plants, covering schools, nursing homes, shelters, lift stations, and jails. We sample from 51 schools that are all part of the Houston Independent School District. This is an example of the SARS-CoV-2 school manhole report that I receive and in turn communicate to the school nurses. It lists schools and the wastewater detection status for SARS-CoV-2 for the schools participating in the school surveillance program. Using the heat map, the red color shows the presence of SARS-CoV-2 in the wastewater sample from the schools. For information on how to read and interpret the heat map, please see the data training modules on how to make a heat map. The current full list for targets include COVID-19, influenza A, and RSV. Wastewater results from the data team are shared with the schools, and sometimes the data is confirmed with what the nurses at the schools are observing as well. Here's another example of a heat map shared with the school nurses. This is the detection of influenza A in the school wastewater samples. For example, we had a wastewater sample that showed influenza A. I notified the school nurse that influenza A was found in the wastewater. She confirmed that she had a case of influenza A. I asked her to confirm with a lab report, and she was able to present a confirmed lab report for influenza A. Communication with the schools is important, as it helps us understand how the nurses are using the data we provide them. Communication also helps the health department have a better understanding of the situation in the school through confirmed case counts. The mutual relationship that is being built will help both the schools and the health department understand what kind of wastewater data is the most useful for our school nurses. The report has gone through multiple iterations as the pandemic has gone through its waves. When COVID-19 was at its peak, and I would get this report, there were 2 nurses dedicated to COVID-19 infection control at the Houston Independent School District. I would hand this report over, and the nurses would visit the schools to assess mitigation practices, to discuss the results with the principal and the school nurse. The nurses used a 21-point checklist developed by the Houston Health Department that follows CDC guidelines on social distancing, hand washing, etc., all that supported decreased transmission. As the pandemic went on, the wastewater report replaced the school district's specific COVID-19 case dashboard for parents and the public to view. Engagement with the school community is an additional layer of communication that helps the school remain in good health. Some of the activities that are part of the engagement include vaccine clinics, at the schools, particularly those with high wastewater viral loads, presenting wastewater information at parent-teacher meetings, hosting trainings about wastewater analysis for the school nurses, putting the school information on the public dashboards, and giving the school district access to school information. This is an example of a slide from a parent-teacher meeting at Lyons Elementary in February 2022, an online event that was held by the school. The manhole reports, such as the one shown here, is the wastewater information for the specific school, allowing parents and the school community members to have better understanding of what is going on. This is an example of the third engagement. Host trainings for school nurses on wastewater analysis. In February of 2022, City of Houston Health Authority Dr. David Peirce gave a webinar for school nurses to explain wastewater, vaccine clinics, contact tracing, and PCR testing. After the training, a survey was sent out to the school nurses with the question, "Having a better understanding of wastewater and its implication helps me to plan and implement strategies to reduce the risk of COVID-19 infection on my campus." When we asked the survey question, most participants answered agree or strongly agree. This is an example of the fourth engagement. Put information on a public dashboard. The dashboard lists the wastewater viral load and testing positivity rate on the right side banner. The school's sampling locations are the dots on the map, and the arrows indicate the wastewater trend for the wastewater treatment plant. Clicking on the arrow at the bottom of the page reveals a more granular look at the schools being sampled through the use of heat maps. We found the heat maps were well received and made sure to include it on the public-facing dashboard. On the dashboard map, clicking on a sampling site dot shows that schools information as a call-out box. This impacts what is shown in the school heat map below, showing the heat map just for the selected school. This is the heat map that is presented with a sampling school selected in the map. The Houston Independent School District website also has links on its site up to the COVID-19 website. The link that is highlighted is the most direct way to show the dashboard through the Houston Independent School District site. Clicking on this link will pull up the COVID-19 dashboard as an embedded figure. This embedded dashboard works the same as the full one from before, allowing you to view information across the city schools or focusing in on just one school. Once a positive is detected, the COVID-19 history of the school must be determined. Recent cases are tracked and the status of the current outbreak determined. Upon identifying cases, we then begin contact tracing with the assistance of the school if the contacts cannot be reached. The priority in any situation is to prioritize school intervention steps to minimize any type of spread. This includes disseminating a wastewater report to the school's leadership and visiting the school. After the site visit, maintain an open channel of communication for daily reporting and ongoing communication with the cases and contacts. If you're interested in learning more about the types of reports and analysis that can be developed to integrate wastewater and additional data sources that can inform public health interventions in your jurisdiction, please check out our other training videos available on our website. Support for this program was provided through a grant by CDC. The Houston Wastewater Epidemiology team would like to thank you for viewing this training video.